So in terms of treatment, right? I told you this yesterday, and I told you this yesterday, okay? But I didn't tell you this yesterday. It's not this. It's not that. It's definitely not that. So don't be confused. That's why I'm not going session by the manual, because it's not a cookbook. This is the reason why evidence-based practices have gotten such PR, because people think it's a cookbook. You have to understand anxiety. You have to be able to conceptualize anxiety, and you have to understand the treatment. And then you can do it with a manual or without a manual. That's my opinion. Oh, I didn't even know that was what was coming. Okay, and so the therapeutic alliance is important then, because you need to get the child to like you and to do things with you and want to come back and to comply. And the alliance is really important. John Weiss actually published a few years ago a really important study where he found that the therapeutic alliance was really highly predictive of positive outcomes in evidence-based practices. And so that is important. Now, do I think the therapeutic alliance alone is enough? No. I think some of the procedures are needed. So both of them complement each other, a therapeutic alliance and knowing the procedures that are used in the evidence-based practices. And this is the other thing that's is important. It's not providing interpretations in the psychodynamic type of way. It's not. It's more helping them to understand their behaviors and thoughts and feelings in the present, in the present situations and the task, rather than trying to say, well, I wonder if this relates to the time, to a more psychodynamic formulation. It's much more in the present and trying to understand their thoughts and feelings and behaviors in the moment. Not to say the past is unimportant. The past is very important. But we're just, the level of interpretation is not at that deeper psychodynamic, intrapsychic level. Not that there's anything wrong with that. I was trained at Case Western Reserve. I mean, I was trained in a psychodynamic perspective. So I'm not like this rigid person. But for these kinds of problems, the here and now and how the current behaviors, thoughts, and feelings are relevant that's what CBT is about. And the evidence is that you can do it in a group, you can do it individually, and you can involve parents. Okay, now, so what I want to do is I want to go through some of the phases: the education phase, the application phase, the relapse, adjunctive strategies. So, the phases are first psychoeducation. And then let's just read it. Collaborative joint effort, tripartite view of anxiety, the rationale of treatment, developing the fear and anxiety hierarchy, behavioral procedures, and cognitive procedures. And then that's the education. Once you do this, you start doing application, which is exposures. And then after that, it's relapse prevention, kind of helping to ensure that the gains are continued and are maintained. Okay. And before I say more, I just want to say back to what behavior, what it is. Your role as oh yeah, okay, now I do, I see now I do have, all right, now okay, I'm good. Okay, now I see that I have slides on each of these points that I will elaborate on. Okay, so I do my work with an emphasis on exposures. So I think you will see in the manual that we start exposures by session 3, and we get kids going and doing things quickly. If you look at Phil Kendall's Coping Cat Manual, which is another evidence-based treatment, he spends the first 8 sessions doing a lot of the cognitive work and then begins doing the exposure in session 9. It's a matter of your own theoretical perspective. I mean, both work, but I personally like to get kids doing exposures, and I'm going to explain why soon. But I just want to make a difference between some of the ways different people implement this. Some people are more on the exposure side, some people are more on the cognitive side. All right, so the role of the therapist, right? Some of you probably know, this, you know, it's C's: a coach, a consultant, a collaborator. So, and again, a lot of the language is in the manual. So, for example, the manual talks about how it's written, and we say to the child, this is a lot like you learning any other type of skill. If you want to play basketball or soccer, do you have a coach? What's a coach? We're going to role play now. What's a coach?
Someone who teaches you the skill.
And what does a coach do? How is a coach, what makes a coach, how does a coach work with you?
They model the information. They show you how the behavior. What is a coach? What do you do? How are you going to teach me?
Okay, but well, a coach. Well, what do you play any sports? You play any games?
Yeah.
What do you play?
I play soccer.
Oh, that's great. You like soccer?
Yeah, I'm a goalie.
Oh wow, that's great. What's a goalie?
I stop the goals. I stop the balls from going in the net.
Okay, and do you have a coach? So we are going to kind of role play a little bit. Do you have a coach?
Yep.
So what does the coach do? How does the coach work?
Well, sometimes we play the game, but they work with me, kicking the ball to me so that I can catch it, or that when I catch it, I fall so I don't hurt myself, and things like that. And how do I throw it back into the game?
And so the coach is kind of like in there with you, right?
Yeah, like
right.
In my ear, I guess you could say.
Yeah, but what happens like after you start playing for a while? Is the coach always there?
No, I'm on my own.
So when I say that what we're going to be doing, what we're going to be working together for the next 12 to 14 meetings, I'm going to be like the coach. So what do you think I'm going to be doing with you?
Maybe the coach sometimes corrects me.
Right. So I'm going to be in there with you and kind of explaining things to you. But as you do more and more things, you're like on the soccer field. You're by yourself. You're on your own. But I'll be there when you need me.
So I'm going to have to practice?
A lot. But we're going to talk about that later. That's the next slide. Okay. Okay. So, okay, here's this for you. Here. It's for you. Tell them, can you tell everybody what it says?
Relax and breathe. And I can't tell you how much more how important that is. And it's by CAPP and FIU.
CAPP, Child Anxiety and Phobia Program. Okay, so, and it's a squeezy ball. So when you're tense and next time, you know.
I actually gave it to some of my kids right before the FCAT.
Oh, that specifically?
Not this fall.
Oh, okay, and you know, and if you guys can see, I have my Face My Fears bracelet. Okay, you see that? That says Face My Fears, CAPP, FIU. So I always wear it. And I always tell my students to wear it, and some of them are resisting, and I say, why? And they go, because we don't like yellow, and now that we've ordered a bunch of purple ones. So, I just hate yellow. I don't want to wear yellow. Okay, and so that's the emphasis. And what does it mean it's a consultant? It means like, it's not your typical, I'm the doctor, I'm the expert. I'm the consultant. I'm here to consult and give you some guidance. But a lot of it is together, we work together as a team. It's very much a collaboration. And that's a very different, I mean, now we know about it, but you know, when this first came out, it was a very different model of psychotherapy, you know, where it's a more traditional model is the doctor is the expert. The other thing that's important is how is anxiety conceptualized in CBT treatment. And anxiety is conceptualized in terms of a tri-partite, which basically just means a three-part view. And it means that when someone is nervous or anxious, it shows itself in three main ways. The first way is behavior. How does an anxious person behave? What's the main behavior that you see? Avoidance. They stay away. Every anxiety disorder. Separation anxiety, avoid being separated. Social anxiety, avoid social evaluation. Specific phobia, avoid a specific situation. Panic with agoraphobia, avoid the situations where they think they may, because they think they're going to have a panic. Obsessive compulsive, avoid things that they think may give them germs and contamination. PTSD, avoid previous neighborhoods or areas where the trauma occurred. Generalized anxiety, you also can have avoidance as well, you know, in terms of the things that they're worrying about. So like if they're worrying about burglars or being broken into, you know, they might avoid ever being left alone. Or if they're avoiding, if they're worried about accidents happening, they avoid situations where they think accidents may occur. So there's always the behavior, there's always the avoidance. That's the reason why exposure is so much emphasized, because we're trying to stop that avoidance. Cognitive, we already talked, distortions, okay? And I'm going to give you more examples of the specific types of distortions that we see with anxious kids. And finally, physiological. Heart beats fast, sweating, butterflies in the stomach, trembling, headaches, stomach aches, vomiting. Vomiting's a big one, and I'm pretty certain that vomiting is a precursor to panic attacks. You know, a lot of these kids with, who vomit end up eventually with panic disorder. So that's the tripartite view, and some kids show their anxiety in all of these ways. Some kids tend to show it more in one way than another. It's different for different kids. Now, most of the evidence-based treatments focus on all of them. But in my opinion, in clinical practice, if I were you, I would ask the child, which way does it manifest? Do you see it most in yourself? I would ask that child that. And I would then emphasize more the way that that child is displaying it. That's what I think. I mean, and I'm not going to get into some evidence for that, but I think clinically you're on safe grounds. But a lot of the kids are showing all of them, and you need to tackle all of them. So we show this to this is how we explain it to the children. We show them the we show them the person, and that's the heart, and that's the stomach, and that's the thoughts, and and then that's the behavior and the running away, and we show it to them. And I have this in the workbook, and you can go use the workbook with the kid. But I actually like also using the board. I mean, I really like using a board and having them like draw a figure, and so I would do it that way. Like, I kind of wish now that we had a thing. I'm going to ask for one for tomorrow. Something to write, because I really would like to write something. So, in fact, is it possible to try to get one now? Help us, you guys. I mean, maybe you find out if there's one available. Thanks. Yeah, because I like to draw the figure, and I like to have the child draw it for me, and draw the thought bubbles, etc. So that's, if we get a board, maybe we can do that.
I think it'll be nice to ask the child, where do you feel the anxiety? Do you feel it in your chest, in your
Oh
stomach,
yeah, no,
in
you
your
go
head?
through the whole, you go through the whole thing. I mean, you draw the figure, you draw the person, and then you say, okay, show me where you feel it, and then they might do things like that, and you can do a lot of fun things with that, and then you can draw the thought bubble, and you can ask them to tell you what the things that they're thinking, and then the running away. But certainly you try to personalize it. So that's the tripartite view that's explained to kids. Okay, and then another part of education, and this takes about the first 2 sessions. The second part of education is explaining the rationale of the treatment and explaining the links of feelings, thoughts, and behaviors. And what I like to do is I like them to monitor between sessions the things that make them anxious and nervous as a way to start getting a handle on things. So, and this is a way for them to understand how something happened and then they had a thought, and then this thought is then related to some feeling of nervousness, scared, or fear. And then also, they then can use this in the workbook to rate how they're feeling or how nervous, afraid, or worried they are. So if you guys can like help me, so let's say I'm going to say, all right, so what is your name? Melissa. So, Melissa, I know when you came here, you told me how it's really hard for you to sometimes do things with other kids.
Yeah.
And it makes you really nervous and scared.
Mm-hmm.
But there's a lot of different situations and places where different kids are that could be hard for you. And I wish I could be following you all day. And
Me too.
Taking a picture of you and seeing what you're doing with all the kids. But I really can't. So this is the best I can do. So is to ask you to keep track of this for me. And if you need help, I'll explain it to your mom, and maybe your mom can help you. So without not even explaining it to you, can you guess? What's your best guess about what I would want you to keep track of for the next week or two?
About when I'm at places I don't want to be.
When it's places, remember you said, you told me that it's really hard for you to be with other kids. It makes you nervous. So for example, today, before you came here, was there anything where you were with another child, with other kids, that was hard for you?
Yeah, PE class.
Okay, so you in PE class, and then let's write it now together. So you in PE, and what happened?
We were told we had to play basketball.
All right, told you how to play basketball. Okay. What were you thinking when you were told that?
Oh no.
Okay. What else besides oh no?
I don't know how to play basketball.
I don't know.
And no one's going to pick me for the team.
All right. I don't know how to play basketball, and no one's going to pick me. Anything else?
And I don't want to look like an idiot.
I don't look like an idiot. Okay. And how did that make you feel?
Like an idiot.
Like an idiot. Okay. I felt like an idiot. Okay. And some people, use, I don't think I have it in I think we might, but you can also use and I'm sure most of you have these feeling faces. Everybody's got that. We have feeling faces in our offices, and we help, with the younger kids, we help them identify the feelings. So, I'm not assuming in the beginning that they even know what types of different feelings people can have. So that's, I've already assumed that we've gone through that. Okay, and that was feeling. So do you see what do you, and how did that make you feel? Before we were using 0 to 8, but now we got 0 to 10, where you're not worried or scared at all, whereas 10's like really, 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 really worried and scared. So, and then you got 5 or 6 is sort of in the middle. So where do you think you are in terms of how much you feel like an idiot, and how much that bothers
I think like
you?
an 8.
An 8, so that's pretty high.
Yeah.
Okay. Now, do you see? Is there something else that you can see from this? Like why do we have this and that and that?
So that I can see what made me feel like an idiot?
Yeah, so because right now, you're feeling like an idiot. But how does feeling like an idiot make you feel anxious?
Well, I get really afraid of looking like an idiot.
You're afraid. You think the kids are going to laugh at you.
Right.
And that would be pretty tough.
Yeah, so I ran away.
You'd run, yeah, because you don't want, who wants to be an idiot with other kids?
Right.
So what we're going to do is, I want to find out more about all the different times that things like that happen, and what you're thinking and what you're feeling. And I'm going to give you this, and if you could keep track of this during the week. And next week when you come back, we're going to go over that. Okay?
Okay.
And why do you think we're going to go over that?
So I can learn more about what I'm afraid of?
Well, yeah, because we want to find out. We only have 12, 14 meetings. I don't know how many meetings you have, but we don't have that many meetings, and we want to try to get as much done in a short amount of time as possible. So it would really save a lot of time if we could really find out what happens, what happens most often and what bothers you, so we could work on that. And I'm going to tell you more how we're going to work on that soon, okay?
Okay.
And let's practice another one.
Okay.
Okay, but we won't, but okay. But that's, you know, this is self-monitoring, you know, but it's a good thing, self-monitoring. And again, if the children need help from their parents, then get them to get help from the parents. But that really helps, because if you don't focus it like that, what you're going to get, what do you think you're going to get? If you don't like focus it on the way I did, what do you think you're going to get? If you just give them a sheet of paper and say to keep track, or first of all, you just ask them, they're going to say, I don't know, I don't know. And that's why I say, well, tell me what happened today. And then tell me if something else happened today. Then I'll say, well, did something happen yesterday? So I would do a few specific examples like that. Now, the next thing is but why is that better than just give them a blank sheet of paper? Yeah, yeah. If you give them a blank sheet of paper, they don't know what you're asking for. And they're going to give you, like, give me some examples of what you think you get if you don't specify it.
Well, I get scribbles. You get your scribbles. They take black or red usually, and you just get scribbles.
Yeah. You get, like, yeah, and just things like, I was sad, you know, just things like that. I was sad, my mom yelled at me, my day sucked, I didn't want to clean my room, you know, so you need that kind of specifics. Okay, and this is also another way of doing it. You know, again, all of this you have. It's the daily diary, what happened, what were my thoughts, and the rating. Okay, that's just the same concept. Again, that's just education. That's just trying to get some information from the child. That's not related yet to intervening, but that's how you start trying to get at some of the thoughts that they have. Now, and we're going to talk more about that. This is right now just an overview of things. Now, as I say, the key procedure tends to be exposure. And exposure in these treatments can be done in a graded or gradual fashion, or it could be live or in vivo. I'm sorry, it's graded and gradual. It's not flooding. It's not putting a kid with German Shepherds in a locked room. You know, it's graded and gradual. And it can be live, in vivo, or imaginal. I try as much as possible to do live, in vivo. We'll talk about how you can do it imaginal, but I like it live because I think you can get, you know, more affect aroused if it's live, because otherwise you have to deal with wondering whether or not the child is getting it really clear in his or her imagination. But we're going to talk about how you do it imaginal too. Okay, and as I said, all EBTs include exposure. And I told you when education support, when it worked, I believe it's because we told people, if you stay away from the things that bother you, you're going to keep being scared. And I think they learn to gradually face their fears and to do exposures. What's going on? It's like a party going on here. Okay. Okay. So all the EBTs involve that. And it's important that you understand exposure is a procedure. It doesn't really explain what, it's not a theory, it's just a procedure. You do exposure. And this is what you, and now I want to give you some background about why do exposure. And again, this is back to why I think it's really important to understand conceptually the basis of the treatment. The basis of the treatment, theoretically, is that if most people, when they're anxious, and they keep being anxious, that's, you know, what typically happens. You're nervous, you're scared, and as you know, and you just keep being more and more scared, your ratings go up. That's what happens. So the more, you know, you just get scared. That's anxiety. It usually shows that kind of pattern. And what happens, though, is that with exposure treatment, you're trying, yeah, let me do this first. That's the joke, okay? That's the exposure. That's the one I forgot about. Professor Gallagher and his controversial technique of simultaneously confronting the fear of heights, snakes, and the dark. All right, that's the joke I was showing you yesterday. Now, what happens with, I showed you the typical anxiety response, but what happens with exposure within session is that when they are facing their fears, when they're exposed, and this is hypothetical, but this is theoretically and experimentally shown, you get maybe you have that typical response. That's what happens. But over time, it starts habituating or extinguishing. That is the reason. And so when people ask you, why would being in the situation that makes me scared make me less scared? And you have this in your manual and in your workbook. There is a curve like this in your workbook, and we show this to the children. We show this to the parents. This is shown with dogs and rats. I tell the kids this. If you put a dog or a rat in an exposure situation, they will eventually show a decrease in their avoidance behavior. This is an experimentally derived theory. Yeah.
Based on locus of control and sense of resiliency.
Okay. There's many different reasons why this works. And when a parent asks you, you say, well, there are many different reasons why it works. And I'm not going to tell you the reason. I can only give you the different explanations that are out there. So let me tell you some of the different explanations. And you can tell me which explanation you think makes sense to you. One explanation is this. This is the thing, but I'm going to demonstrate it. This thing. How did I feel when I left? That's this theory. Well, it is. That's the theory. Feeling better can make anxiety. Well, the theory is you feel better, but you also know that escape eliminates fear, so you are more likely to avoid the next spider and your fear grows. So in other words, my going away makes me feel better, right? I'm scared. I'm afraid of the mic. I can't. I have to talk in front of you. I'm nervous. I'm scared. I go away. My anxiety is reduced. So it's it's a negative reinforcement. Something so horrible, I can get rid of it by going away. And why then do people with anxiety keep avoiding? They keep avoiding because it's reinforced by the fear reduction. If it didn't reduce your fear, you wouldn't keep avoiding. You keep going away from what makes us scared. If I if I had anxiety about speaking in front of you, I will never do it, and I will feel great. I'm not anxious. I don't have to give a talk. Great, I'm not doing it. I feel if I have to do it, I'm anxious. But that's why you need to do it, because if you do it, then you have this. You have this. And this is a scientific fact. There are very few facts, but this is a fact. I mean, this is hypothetical, but clearly you have reduced anxiety or arousal if you stay in the situation and face and as my thing says, face your fears. Oh, I'm sorry. This is SUDS. This stands for Subjective Unit of Distress. What's that? And this is just a way of rating a scale. It's not that important. Yeah, this is the number of minutes in a session. Well, you don't have to. This is hypothetical. You don't have to. It could be, we'll talk more about that. It's time of session. So this is the number of minutes. Yeah, but this is all hypothetical. It could be, but this is a within session. So this is within a 90-minute session. But it's hypothetical. It's hypothetical. It could be 60, I just wanted to make the point that, and actually this is Debbie Beidel's slide. Thank you, Debbie. But this goes like that. It's just the idea that it goes down. Okay? So, so this is the idea, I mean, this is the language. This is the important point. Avoidance behavior is reinforced through the process of operant conditioning. It's negative reinforcement. Negative reinforcement means an aversive thing goes away. And it's reinforcement. Reinforcement increases behavior. Whether it's positive or negative, I'm going to keep doing something because of reinforcement. If something has been negatively reinforced, like going away, I'm going to keep going away. I'm going to keep going away. Just like if you give me $1 million, I will face it. And that's my positive reinforcement. So you can give me negative reinforcement to get rid of it, or you can give me positive reinforcement, like $1 million, and I'm with you guys, okay? But that's the reinforcement principle, and that's behind exposure. That's one theory behind exposure. And what happens, and again, this is a great thing, and this is, I really believe you got to explain this to children and parents in a simple way, because then they understand. Otherwise, they think you're torturing them, you know? Oh yeah, and I'm going to say more about it. So here's what, and this is what happens. Again, it's hypothetical, but this is session 147. The more you do it, it goes down. And that's why I do exposures in every session, in session, between session. I always have them do things, because I believe the more they practice and learn these things. I mean, not everybody needs a professional help. I mean, if you can, school counselors, certainly you can try to do some limited avoidance yourself or tell parents not to avoid. They only need to come to the Child Anxiety and Phobia program when it's so intense that the avoidance is too intense and they need more professional, systematic help with doing the exposures.
How does your clinic or your people treat children that have phobia of coming to school? How do you do that?
Well, I mean,
Do you do it with?
well, as I said earlier this morning, if you're not in school, it could be due to separation. It could be due to social. Remember I showed the slides of the heterogeneity of school refusal? So it could be due to separation. It could be due to social. So what I do is I try to understand what makes it hard for you to go to school. And once I've determined what it is, if it's more separation, then I would treat it as a separation anxious case or a social case. And so I mean, as we're going to learn over the next day and a half now, you can do exposures for everything. You can do exposures for separation, and so you can do this so it's all about that.
So you have to work with the parent as well?
Sometimes yes, sometimes no.
The child is small.
Yeah, if the child is small and you need the parent's assistance. But we're going to have to talk more about that. But, okay.
I have a question about the frequency.
Like, I don't know, different literature, but with adults, the more frequent and the longer duration, the faster they seem to recover, like agoraphobics and things. Is it the same with children?
So we have a 12 to 14 session treatment. Phil Kendall has a 16 session treatment. Tom Ollendick is treating phobias in a single session for 6 hours. Phil Kendall now has a small grant, R34. I'm actually a consultant on that grant, and what he's doing is he's taking his 16 session coping CAT and he's making it into a 5 session treatment. And I mean, it's still a work in progress. I mean, I'm joking to him. I say, Phil, so after all is said and done, you're going to end up with a lot of exposures because you can't do all the coping CAT now in 5 sessions. So to answer your question, I think the movement in the field is shorter, streamlined treatments, what I was saying yesterday. So what's the answer? So the answer is, we really haven't done that much experiments on comparing the length of treatment. I mean, but Tom is doing it in 6 hours, but that's a phobia. I don't know if you could do it with other problems. Does that answer your question? I mean, okay. Well, I mean, flooding means doing it all. Flooding doesn't mean gradual. Flooding means you start from the top of the hierarchy, and you don't really want to do flooding with kids, I don't think. I mean, unless you want to like, really, yeah.
I actually worked with a young child with selective mutism, and through real gradual exposure, got the child to totally participate in a school situation and to function normally in a school situation. It was over a period of from preschool to about first grade. As that transition changed, there were tendencies to regress, but then continually moved on. That's why I questioned about whether it was resiliency also and locus of control, because it was always try to feed her to the point where you can control this, and each time you did it, that's that positive reinforcement. You can do it, and nothing bad happened.
I do have more slides coming for other explanations about why exposure works. Right now, I'm giving you the extinction, habituation, physiological reason, which is, the curves. So, but I'm going to give you more reasons soon related to what you just said.